Okay, Sam. My name's Alan Yancey. I am,
My husband?
my husband. No, I'm not your. I am your husband.
Yes.
Sam, how was your day today?
It was pretty good. I basically just worked on the podcast and my aromatherapy class.
Way cool.
And I don't know if you've noticed, but I cleaned up our
Oh
office.
man, it is so nice.
Mm-hmm.
It smells good.
It does. Yes.
It feels good.
Do you want to know what that was? The smell?
Yeah.
So I made a carpet powder.
You made a carpet powder?
I did, with baking soda, eucalyptus, basil, and juniper. Oh, and lemongrass.
Okay.
Yeah, so that's what you smell in here. Is the carpet deodorizer.
Well, can you make that for the whole house?
I can, yeah. We just need more baking soda.
Okay.
Yeah. So if you want to get one of those like big bags,
Big bag of baking soda.
really big bag, yeah.
Yeah.
Then I will totally do that.
Yeah, I always like to have baking soda around.
Yeah. I mean, it's good for what else you?
Oh yeah, all kinds of things.
All kinds of stuff. Yeah. Carpet deodorizers,
Right.
refrigerator deodorizers,
Toothpaste,
toothpaste, a,
deodorant.
a facial exfoliant.
Yeah, that thing is just like priceless.
For everything, yeah. Oil fires.
Hmm.
Throw some
Yeah,
baking soda on that shit.
baking soda is nice.
Yes. So, how was your day, Alan?
Well, Sam, I'm glad you asked because it'd been rude if I'd have been sitting over here and I asked for your day and then you don't ask for me.
That would have been rude.
That'd have
yeah.
been rude.
Yeah, it wouldn't be the first time that happened.
My day was fantastic, Sam. I went to work at the old spa and ended up doing 4 in a row, and then I went and did a client for myself later on.
Wow.
I know.
You're busy.
I'm old.
You're
I'm too old for this.
You're getting too old for this?
Getting too old for it.
Well,
You know, 5 a day is pretty good, though. I don't want to do any more than that.
Yeah, no, definitely not.
Mm-mm. So, all the young massage therapists starting out there, remember to watch out for your body and don't overload yourself.
Listen to Uncle Alan.
Or not, or don't. That's okay.
Or don't.
Yeah.
Yes, janky whippersnappers.
Yeah. All those young kids. I have people at the spa that are doing 8 a day.
Which is just ridiculous. I mean, they can't. I'm just saying, like, they can't really be doing
And they're
like deep tissue and stuff.
and they're wondering why their back hurts and why they can't.
Duh.
Why their fingers are tingling.
Duh.
I know why.
Yeah.
Not only are you doing 8 massages, but you're doing 8 massages with really bad body mechanics.
Exactly. You know, that is one thing that most massage therapists struggle with is body mechanics.
Well, yeah.
And, like, you can't really... Oh, God. Like, I can teach body mechanics, but that doesn't mean that the concept will actually make sense in your head. You know? Like, you really have to feel it to understand it. And then you have to use it correctly to really understand it. And sometimes that takes a lot of time. Sometimes you have to just beat the shit out of your body before you really hit that sweet spot of this is what they meant by body mechanics.
Yeah, after a while, when your back is hurting so much, you decide, I've got to do something about this.
Yeah. When you go home and, like, your shoulders are hurting.
Yeah.
Because you've been, like, raising them up to apply more pressure.
Yeah.
Yeah. Mm-hmm.
Guilty.
Mm-hmm. Which reminds me, I need to give you a massage tonight.
Well, all I need is some lower back massage, and it goes right to one of our topics today.
Actually, you know what it does? Do you want to go ahead and just jump right in?
Well, might as well go to the first topic because I could not have brought it up any better than what I did.
That really was perfect.
Yeah,
I
thank
mean,
you.
like, we didn't try to segue at all, and it just
No,
happened.
it's
Yeah.
happening.
Just so that you know, people who are not in this room,
Yeah.
in no way whatsoever is anything that we do planned.
Or professional when it comes for podcasting.
Absolutely not.
We don't know what we're doing.
Yeah, that is very true.
But I tell you what, I know less of what I'm doing than Sam. I can guarantee you that.
Yeah.
Yeah, she's the executive producer and does all the editing, does all the... I basically sit down.
Yeah, you basically just like sit down and like, yap
Yeah.
your pie hole.
Yeah, that's right. You point to me and I talk.
That's it.
And, whatever comes out happens to come out.
Yeah.
And, sometimes it comes out in complete sentences, other times it doesn't. I've noticed over the first couple of podcasts that I am a rambling man myself, so.
You're not only a rambling man, but you're also a clipping man, so try and be quieter.
Clippy man.
Clipping.
Clipping.
Yes, it's when you talk way too loud for what the mic can handle.
Oh, okay.
Yeah.
Well, see, I learned something today in the industry that I didn't know before.
Yeah.
Am I clipping now?
No, I just kind of reset it so that if you do start to clip again, it'll let me know.
Mm-hmm. So we're learning as we go, and hopefully it's going to get even better as it goes.
I hope so.
What do you mean?
I hope it gets better and easier.
You thinking that what we're doing is not good?
Oh no, I mean, like I think you and I are doing exactly what we would be doing anyway.
Yeah, all we're doing any different on any day is that we're mic'd.
Yeah, I mean,
because we'd be doing the same thing at our kitchen table every night. Yeah. And we decided, hey, let's put this on a podcast.
Yeah, that really is the only difference. Yeah. Instead of sitting in the situation room, we just happen to be sitting in my office with mics on.
That's it.
Yeah.
And so if we tend to ramble or have inside jokes or have Momo walking over
Hi, Mo.
the desk, that's tells you how professional we are.
That is normal. Yeah.
Yeah, that's normal.
Hey, Momoski. Momoski break came early today.
Yeah, Momo needed some loving now.
Wait a second, bitches. Come here and love on me. Hello, sweet kitty. Yes, the mic loves you too.
Yeah, Momo is now rubbing the mic.
Loving up on the mic. Hey.
Well, Momo's one of my favorite parts of the podcast, actually.
Yeah.
Less stress, more loving.
Mm-hmm. Yeah, she's a really good guest.
Yeah, she's a good stress reducer.
What you doing?
Momo, our cat, has traveled across the United States in the back of a car.
That's true.
So, Momo is a traveling cat.
She is. Oh, and so is our turtle.
Oh, yeah.
Our turtle is a traveling turtle.
Yeah, we don't want to go into that because we still feel bad about that.
I do.
We traveled in a turtle and we kept it in a crock pot.
Yeah.
And I'm sure that was psychological damage to the turtle.
I mean, I can only imagine because it was like a white porcelain crock pot, so like all she saw was white.
Oh, yeah.
Like, oh, God.
Yeah, she's still having problems.
And actually, she's not. She's doing really good in this house.
Maybe it's me still having problems. I don't know.
I think we just feel bad.
Right.
Yeah. But no, she's doing a whole lot better here than she even was in Jonesboro.
Well, good.
I really think it's because you and I are more settled now.
Oh, yeah, I know I'm settled. In fact, I'll probably not get out of this chair tonight.
Settled, planted, same thing. Same thing. And Momo definitely seems a lot more calm here.
Yeah.
Yeah.
I'm happy that she's able to sit and look at the birds and move about freely. She's such a sweetie kitty.
I think it's kind of funny that we have rambled ourselves away from the topic that you got started.
You know what? I was close to it and we just rambled away.
We did.
But see, that's what you're supposed to be in charge of this.
But I mean,
I told you I'm not in charge of rambling. You are.
Look, I can't be in charge of rambling and everything else as well. I mean, somebody's got to pet Momo over here.
Well, all I know is that when you point to me, I talk, and you're supposed to point at me again when I ramble. I thought we had this all worked out in the scientific labs here at the...
No.
No?
No, nothing's worked out. Absolutely nothing's worked out.
Well, can we go back to the beginning? What's the topic for tonight, Sam?
Okay, so one of the questions that we got... Excuse me, Momo. Oh, thank you. How do you work low back pain without only working the low back?
You know what?
Where are the other places that you can work?
I'm interested. My lower back, right in the middle, is hurting. Not on a scale of 1 to 10, I'd say about a 6.
Yeah.
But that's too much.
Mm-hmm. Most of the issues with the low back start with everything else is underneath it. if you are vaguely familiar with Ida Rolf's stacked block model.
No.
No. Okay. Well, it's okay. I mean, it's been like 15 years since you were in school. So.
And I wasn't good when I was there either.
Well, I mean, I wouldn't call yourself out like that.
Okay. I was pretty good then. Straight
Actually,
A's.
I definitely wasn't good.
Oh, yeah.
I really wasn't. I sucked as a student. I really did. Yeah, but now that I teach, I remember it all.
Yeah, now that I suck, I got a podcast.
Hello, everybody. This is Ask a Massage Couple, and we suck.
Yeah, we've just outed ourselves that neither of us really know what we're saying, but could you follow up on the lower back pain?
So anyway, Ida Rolf.
Yeah.
She is the founder of Structural Integration, but she came up with something called the stacked block model. So if like you can imagine like just like building blocks or whatever, like stacked up on top of each other, but each one represents a body part. And then if I were to eschew one down at the bottom just slightly, that would affect all the others above.
Oh, so like the layering of...
Well, yeah, like basically like each joint is going to be affected by the one below that's slightly askew.
Yeah.
So, if you're looking at her model, like pretty much anything from ankles up or foot up can actually cause issues with the low back.
Really?
Oh yeah, absolutely.
So I could be working on the hamstrings and help the lower back?
Oh yeah, absolutely. Because most of the time, like if somebody has tightness in their hamstrings, it's usually because of tight calves and tight glutes. And if somebody has stuff going on in the low back, it's usually because of tight hamstrings and tight glutes. Yes, you can definitely work those areas.
Okay.
So I'm going to start from the bottom and work my way up.
Okay, so
Now,
we're going from the
feet up.
All right.
Yeah. Now, I mean, also keep in mind that you've got myofascial chain that run from the feet all the way up to the forehead as well.
Okay.
And then, along the front of your body too. And kind of like if you pull a sweater tight in one area, the rest of the sweater becomes taut as well.
Yeah.
You have to think of that as well. If there is a tight area somewhere in the body, usually everything around and adjacent from that area is going to be affected. So when we're talking about the low back, you pretty much need to start from the bottom and work your way up. So anytime that I hear somebody say, I've got low back stuff,
Okay.
I want to work the legs first.
Face up or face down?
Face down.
Yeah.
Yeah. I will start with the heel and the calf, work the gastrocs and then the soleus very well. And most of the time, like especially if it's a runner or someone who is athletic, they automatically think that it's gastroc issues. Sometimes it's actually the soleus. The soleus is kind of weird because you can't really stretch it in that normal runner's stretch that everybody does. Like you have to have your knee bent to be able to stretch that effectively. So half the time it gets tight. No one really knows why and what it does. Along with the gastrocs is one of the things that helps with plantar flexion, like lifting your entire body up on your tiptoes. Soleus, gastrocs, work the crap out of those and then stretch them. Stretch the gastrocs with a straight knee, stretch the soleus with a flexed knee. And this will be like, go ahead and flex the knee up and then toes towards the table. Stretch. And then, of course, working up to like the hamstrings. I mean, because like if you think about where they connect, they go up to like either side of the knee and then up to ischial tuberosity, which is part of the hips. And I'm going to be spending a lot of time talking about the hips. Because the pelvis, the sacrum, and all that good stuff has a lot to do with the low back. So, I mean, yeah, if the hamstrings are tight, it's going to affect the glutes and then the low back. But same thing, if the calves are tight, that's going to affect the hamstrings. So, deep tissue, I really like a nice broad forearm on the hamstrings. A little pin and stretch up the hamstrings. That really opens it up.
Yes.
And then, of course, moving on to the glutes, which I don't think a lot of people realize how much musculature is going on in the hip. Glute max, like glute medius, glute minimus, and those three muscles basically act kind of like the deltoid. One muscle is going to move it a little bit more anteriorly than the other. The other one's going to move it a little bit more posterior, and then all of them together are going to end up moving the leg out as well. But there's like a whole lot of like a medial and lateral rotation going on with the glutes. So if you find that you are maybe standing, say like one leg is straight, so like your toes are facing forward, but then your other leg has a tendency to toes face out away from you,
Yeah.
then that kind of lateral rotation usually causes tightness in the glutes.
Yeah. Very common in massage therapists.
Absolutely, yeah. Well, I mean, it's common for everybody.
Yeah.
From dancers to models to people that just end up standing like that. Because, like, if you think about, like, somebody trying to give themselves a wider base of support, it would make sense that you would want to splay your feet out.
Or anybody that has to be on their feet all day.
Oh, yeah, absolutely. Yeah. Glutes, hamstrings, quadriceps, they all help in moving your body around. If you're on your feet all day, obviously you're going to be in pain. And then, of course, you also have like piriformis, quadratus femoris, and then the gemellus superior and inferior, and then obturator, internus, and externus. And all of those are basically just like minor lateral and medial rotators.
Mm-hmm.
But you gotta get into those areas
Right.
if somebody has low back stuff.
Well, it sounded like you're just going through a Harry Potter movie there for a second. It sounded like you just listed some kind of...
The obturator,
Yeah. Like I'm...
externus,
yeah, something...
gemellus,
Turn me into a toad.
inferior. Anyway, so yeah, like work the glutes, and I think we said it on like another podcast recently that, you know, just make sure that you always double check with people about how they intend on you working the glutes, or if they even want you to. Some people that is like big, like hard no.
I wonder why, because
Because it's your
it's so
ass.
needed.
Because it's your ass,
You know
Alan.
what, Sam? I work on glutes every day.
Well, I mean,
Do you
so
know
do I.
99% of the people I work on their glutes?
Well, yeah, because it's a major muscle group.
Right.
But I think it was you that was talking about
Yeah.
this. When somebody has a boundary
Right.
and they're not willing to open it up even a little, you
Right.
don't cross it.
No. In fact, usually there's something on your intake form. You know, somebody even will mark down that they don't want their glutes worked on. You know,
Yeah.
that's good to have something to start off the massage with and say, hey, is there any areas you do not want me to work?
The second that somebody says, I've got low back pain,
Yeah, I say, can I
Like,
do your glutes?
okay, in order for me to effectively, you know, work out your low
Yeah.
back stuff, it really helps if I can work on your hips
Yeah,
and your glutes. Is that okay if I work on them?
yeah, and that's would be a good time to tell them about the pain level,
Mm-hmm.
how deep you're going to go, 1 to 10,
Yeah.
things like that. Because when you get into the glutes, sometimes it can be painful.
Well, not just pain level, but also how to undress. Like, do you want me to expose the glute and then work on it like, you know, I do with like my hands with medium and
Mhm.
that kind of thing? Or would you rather I stay like over the sheets and do it with compressions and movements?
Hmm.
You know, like that kind of conversation needs to be had well before you start talking about how painful it's going to be.
Well,
And like you also have to think that like not every time that you work on someone's glutes it has to be painful.
no, it doesn't. But if I'm working on something that I know that will be, I'll make sure I tell them.
Totally.
Yeah, not glutes is not. Sometimes it feels really good. It's
Mhm.
not
Yes,
painful.
it does. Yes, it does.
But there are sometimes it can
Yeah.
hurt.
Oh god, yeah. Especially if you're right over the gallbladder 30. Jeez, that one sucks. I don't care who you are. That guy sucks every single time.
Has something to do with the sciatic nerve.
Well, yeah, because it's right there.
Right.
Because you're hovering right over the piriformis.
Yeah.
And sciatic nerve goes right up underneath the piriformis.
Gotcha.
Absolutely. So,
So please let us do glute work.
yeah, I mean, especially if you have low back stuff, like we gotta do glute work. So, you know, like after you get through calves and hamstrings and then glutes, then usually the low back has fascially relaxed enough so that you can actually get in there and do some stuff. And I definitely encourage, if somebody really has a lot of low back pain, go ahead and throw some moist heat on the low back while you're working the legs.
Oh yeah.
Yeah.
That feels good.
And then when you actually get into the low back to work the QL and the latissimus dorsi and then all the erectors along the spine, they'll be nice and open to receive the work. And then, I'm just going to say this. Make sure that you're asking them about their lifestyle, because if it is a person that is doing a lot of sitting day in and day out.
Yeah, that makes me feel a lot better, because when you said lifestyle, I thought you were going to go, if they have a partner or not.
No, absolutely not, Alan.
Okay.
No, like, what do they do for work and stuff?
I know, I'm just...
Or, like, are they pretty, like, sedentary? Are they, like, sitting down watching TV all day after they left their desk job at work? You know what I mean?
Computer all day, then computer all night.
Yeah, exactly. So, I mean, double check about that, because it's a good possibility that you might need to open up, like, the abdominal muscles and possibly even get into the psoas. Yeah, I know. Just to kind of counterbalance that low back, because, I mean, like, deep tissue and massage is really, at the end of the day, all about balancing out the muscles in the body so that it can perform better. So that you're not hurting, so that it can go through a nice full range of motion, hopefully. But that requires balance in the muscles. So if the low back is going to be tight, then more than likely the abdomen and the hip muscles are going to be tight. Anterior hip muscles are going to be tight as well.
One thing I like to start off with when I start a massage with somebody who comes in with a lower back pain is stretching. I have a couple of Thai massage stretches that I use.
Heck yeah.
Just to start off with. That way it will open it up. That's just one way to start. And so stretching is always a good idea.
Absolutely.
And I do it before we do the massage. That way I can get in there a little bit deeper.
Yeah. I mean, it really just depends on the person. Sometimes stretching without the muscle being warmed up is not really good, but sometimes the client responds very well to that. Like, kind of change it up if need be. Like, stretch before, stretch after.
Oh, yeah, we can do both.
Yeah.
Or one or the other. Yeah, of course, everything is up to the individual that's coming to you.
Oh, God.
You've got to build what you're going to do for each individual person.
And then the last thing that I really want to talk about with low back pain, obviously we can't really do a whole lot with this. Well, I mean, we can, but we can't. If there is a spine misalignment going on, or in this case, pelvis misalignment, I mean, obviously, like, always check the posture. Like, put your hands on bilateral ASIS, see what's going on there. Are your hands level? Is one side rotated forward? Is one side, like, kind of up and back, or, just whatever. I mean, obviously, we're not chiropractors, but I would always encourage someone to maybe check that out if they are continuously having hip and low back issues, and I see that they are misaligned.
Yeah.
Now, there's definitely some stuff that we massage therapists can do that's actually more like working with the fascia. So I have a set of wedges that I will use, and you can wedge up someone's hip. So, like, let's say that the right hip is more forward, then while they are laying face down, you can put a wedge under that right hip, right at ASIS. Them relaxing into that wedge will fascially relax the hip. Yeah. Sometimes back into full alignment, but sometimes just,
a gentle
better
adjustment.
Well, we definitely don't want to say adjustment.
Well, we don't say adjustment. How about we encourage the body to go to its regular state?
We're basically relaxing and balancing the fascia.
Okay.
Yeah. And should that happen to relax and allow the bones to go back into alignment, awesome.
Yeah. But that's not who we are, and that's not where we're goal.
No, but it is something that we can do fascially to help out the hips in that scenario.
The same way with stretching. Sometimes that will actually help.
Well, I mean, same thing with, like, when we do massage down either side of the spine. Yeah. Sometimes relaxing the muscles in the fascia will actually allow a vertebra to go back into alignment. And it's not like we're going for that, but if it happens, great, that's your body healing itself.
Yeah, it's always better for me personally. Now, I've heard both sides on this. Is to get a massage before adjustment. What do you think?
Yeah, I mean, honestly, it's kind of like with the stretching thing. Everyone's body does its own thing. So some people really did better with an adjustment before massage. Some people do better with, massage before adjustment. It really doesn't matter. Just listen to your body and see which one, it needs.
Yeah.
If your muscles are so tight that they can't hold an adjustment, then it might be a good idea to get the massage first.
Yes.
But if it helps your body to get aligned first, so that then the muscles can start to get their relax on before somebody even touches them, then hey man, do that.
All right.
Like it's definitely up to the person's body.
Yeah. Everybody's different.
Everybody's different, but I think a lot can be said for people becoming a little bit more mindful about what their body is feeling while it's happening.
You know, that's a whole topic by itself, is being mindful.
Oh yeah, but I think,
Write that one down.
Okay, I'm gonna write that down right now. Yes, sir. But one of the main things that students tell me when they're in school is, why am I hurting so much? I never used to hurt this much when I wasn't doing massage. First of all, you're putting your body through some weird stuff that it's not used to. Yes. But number two, and I think this is actually the most important part, they are listening to their body and becoming a lot more mindful of what their body is feeling.
Oh yeah.
And I think that if you can listen to your body when some of these things are happening, don't just check out while you're on the massage table. I mean, sometimes that's nice, but if you're actually there for some restorative work, feel your body go through that and see how it responds to this stuff. Do you do better with stretching before massage, or do you do better with stretching after massage?
Yeah, you're right about that, Sam. People are not in tune with their own bodies.
Oh no.
That's very evident in the clientele that I see on a day.
No, it's true with new students coming in. It's true with clients. Yes. I mean, it definitely seems like a lot of people are kind of checked out from their body.
Yeah, and I was going to mention this to massage therapists out there. I've got a pretty good idea why my lower back hurts. I did one massage and was too lazy to change the table height.
Yeah.
I thought, it's just one massage,
Oh, God.
I don't have to change it. Mistake.
That one massage will do it.
Solid.
If you're not watching your body mechanics while you're doing that massage, I can't even remember where I was doing a massage and the table was crazy low. Oh, it was the last integrated class that I taught. Everybody in that darn class had their table super low, and I mean, I'm not super tall, but I have longer legs for my body, so my hip to foot ratio is just a little bit taller. So I had to really get into this crazy big lunge, and it was just too much work.
That's right.
It was too much work. So I found myself just when I would go around and do a demo on different people, I usually like to go to different people and work on them. Mm-hmm. But with that class, I had to go to the tallest table. I don't know who's on this table, but I'm working on them because it's the tallest.
That's right. It doesn't matter what you're needing, you're
Yeah.
getting work on.
Yeah, I don't care because my back is hurting.
I heard that.
Yeah.
Well, Sam, thank you so much for going over the lower back issues for us.
I mean, I hope that helps somebody, because definitely in the years that I've been doing massage, I had to learn for myself.
Yeah.
Just
Right.
paying attention to people's body and what works and what doesn't.
Right.
And I definitely find that if something's going on with the low back, it's usually everything else below it that's causing it.
Right. Well, thank you so much for going over the things that we can massage besides the lower back.
What is your question? I forget what you had.
Mine was having visitors in your massage room.
Oh, yeah, that's right. Okay, so now when you say visitors,
Yeah.
we're not talking about the alien race, correct?
Well, as far as I know, there could be visitors there already. I'm not accounting for those people. Okay. Well, having visitors in your massage room has to do with people besides your massage guest or your client.
So this would be like boyfriends sitting in there?
Boyfriends. I've had boyfriends, girlfriends, moms, dads, daughters, any kind of relations. I've had a
Yeah.
visitor in the massage room.
Kids?
Well, kids, of course.
Yeah.
Speaking of kids, this is the one I want to go right off the bat with.
Okay.
Is that if you have anybody that is a minor, have an adult in there with you.
Oh, God, yeah. Yeah.
It's always the best choice.
Because, I mean, so it sounds counterintuitive that if, like, you want to go in and get a massage and you've got your, like, you know, your young kid with you, like, you're an adult, you're their parent, you're in the room with them, yeah? But you're totally checked out getting a massage. Meanwhile, your kid is, like, you know, like, messing around with stuff over here.
Oh, yeah.
You know? And it's just, it would be rude for me to say something like, sweetie, don't touch that.
Yeah.
And, like, you never know how parents are going to respond to that, to that kind of thing. Like, you little bastard, put that down. You know?
Sam, I've even had women that have brought infants.
Oh, my God, no.
Yes. I've had every age you could possibly think of. And,
You know what? I have a story. I mean, I'll share it later, but
Okay.
remind me that I have a story. Go ahead.
About a visitor in the room?
Kinda.
Okay.
Yeah, we'll talk.
The other times that I usually have is people who request to be in the room with the other person.
Yeah.
And that's not uncommon. I had one today, and it was just a teenage daughter with her mother. You know, if she wanted to come in and sit in the massage room, I don't have a problem with that.
Now, when you say teenage, how old is teenage?
Well, 13, 14, 15, something like that.
Okay, yeah. Well, in most places, like below the age of like 15, you really should have a guardian in the room with you.
Yeah, but I'm talking about she was the teenager as the guest. Her mother was the massage client.
Oh, okay.
Yeah, but you're right. Anybody under the age, for me personally, anybody that's a minor.
Yeah, no. Like anyone under the age of, I want to say in Georgia it is 13 or maybe 14. I just usually kind of cut it off at 15. Anybody other, under the age of 15, I need an adult in here with. So what, okay, so it was the mom that was getting a massage.
Yeah.
And then the daughter was in there.
Yeah.
Was the daughter watching you?
Actually, she does what most teenagers do at that age. She was.
She was on her phone.
Yeah, she was
Yeah.
texting.
Okay.
But she wanted to be in there, and her mother wanted her to be in there too.
Okay.
So I don't have a problem with that.
Yeah, no. I mean, especially if she's just going to text the whole time.
Right. It's not like she's interfering with anything, and she said it'd make her mother more comfortable if she was there.
Yeah.
And that's what we want. We want the clients to be comfortable.
Yeah.
But if you have small children, please leave them at home.
For heaven's sakes, like find them a caretaker,
Right.
not during the massage.
Do not bring them in and with your massage. Now, most spas will take care of that before they get to you.
Hopefully.
Some won't, though.
Yeah, it really just depends on the manager and how experienced they are.
That's right.
And if they're actually in the massage industry, meaning that like they are a massage therapist, an esthetician, like they're in the industry, like they have done their dues and they know the stuff.
Well, as being a mobile massage therapist, I've gone to many homes with the mothers and kids there.
Mm-hmm.
And so it's hard for say to your kid when you go into their home, could you please have body, they don't want to have a babysitter for that hour.
Yeah.
But they should.
They really should.
I mean, if they have it an hour, they really should take advantage of getting a massage.
Yeah. Every 5 minutes your kid yelling, Mom, Mom, or
Right.
Dad, Dad.
Just find somebody. Just
Like,
please.
Yeah.
Find somebody to babysit for an hour.
Mm-hmm.
The other one I have are people that are elderly. Usually they are accompanied by their daughters or sons.
Mm.
Now that's kind of a common one that I get occasionally too. But just like what we were talking about earlier, you do everything by a case-by-case situation. Now this has happened to me before, Sam. What if you go in and the person does not want the other person to come in?
Yeah.
Now I've actually had that.
Yeah.
And I've actually had to say, you're not welcome. What's awkward.
Yeah, that is awkward, especially if they didn't talk about that before. Just
Yeah,
have a
it's
seat
just
in the
something
lobby.
that
It's
you get in
okay.
the middle of a dispute over, somebody coming to get a massage.
Mm-hmm.
But majority of the times that I've run into it, it's fine. I don't have a problem with it. I've had other massage therapists that are a lot more stricter than I am,
Yeah.
and I understand that. I
Mm-hmm.
really do. But I'm more lenient when it comes to things like that. I have had one come in on Valentine's Day, a boyfriend, and asked me if he could film the massage.
Ew, that's so gross.
And he actually wanted to Snapchat it out live as it was happening.
No, absolutely not.
Yeah, there's some things you say no to.
That's ridiculous.
Yeah, and so there are occasions where you say, "No, I'm not gonna." You don't. You need to stay in the other room.
So this is a really good spot for me to tell my story. Do you
Okay,
mind?
here's the story.
Okay. So I was working at the chiropractor's office. I had this semi-regular client. This particular semi-regular client was always busy. Like, she was always running in late. She was always, like, out of breath. Like, okay, I'm here. Like that kind of thing.
Always late.
Always late, and always, like, she had to reschedule last minute.
I hate that.
Like, that kind of thing. Like, she was that kind of person. You know what I mean? And from what I understand, that really was just her job that was making her like that. But it was annoying at times.
Sure.
Because I never knew if she was going to come in or if she was going to, like, quote unquote, forget because she was stuck in a meeting, blah, blah, blah.
Blah blah blah.
Okay. So she comes in, and this particular day, she comes in about 10 minutes early.
Well, that's good.
Yeah. And I was like, oh, wow, you're here early. She's like, yeah, I need to set up my laptop real quick.
Huh?
Yeah. And I'm like, what do you mean?
Now this was in the massage room.
Yeah. She's
What
like,
is she doing?
I'm about to tell you.
Okay.
Wait for it.
What for it?
So she's like, yeah, I need to set up my laptop. And I'm like, what do you mean you need to set up your laptop? And she was like, well, I have a video conference in the middle of our time.
So she wanted to have a video conference
Yes.
live while she got a massage.
Yes.
No.
Yeah.
No,
And-
no. The answer is no.
Yeah. But she came in honestly thinking that I would be okay with her having a video conference meeting while she was getting a massage.
So she was being Skyped out, and you giving her a massage.
Yeah.
Who would want that?
Well, okay, so this was her logic. So she had canceled on me like so many times before that she felt bad if she had to cancel on me again.
Yeah.
So she was just trying very hard to just make it work.
Well, that was nice of her, but I would have called and asked.
Yeah, seriously. So I basically was like, no, you're not going to be video conferencing during your massage. And she was like, well, I mean, I'm going to be covered up the whole time and blah, blah, blah. And I was like, yeah, you're going to be covered up the whole time, but you're going to interrupt the massage.
Yeah, right.
And yet, at this point, you might as well just not even have the massage
Right.
if you're going to be video conferencing during it.
I've had people on the phone the whole time.
Oh, yeah. Like, if somebody... Okay, so I've had somebody, like, have their phone on them and then take a call during the massage.
Oh, yeah, I had that.
I will immediately take my hands off
Yeah.
and say, okay, just let me know. Oh, yeah. And they're like, I have to take this. I'll take my hands off. It's like, okay, yeah, you just go ahead and take the call.
Yeah.
And then, like, sometimes if they actually engage in a
yeah,
conversation
let me know
with the person,
when you're ready.
I will say, well, I'm going to step out of the room real quick and give you some privacy.
Right. Just let me know when you're ready.
I will not allow someone to be on the phone during a massage. That is ridiculous.
Yeah, and
Like,
it's
you're-
ridiculous
you're-
that somebody would think that they
Exactly.
could be on the phone.
You're
That's
cutting into
ridiculous.
your time, my friend, because my hands are off of you and the clock is still ticking.
Tick tock goes the clock.
That's right.
Yeah, I'm
Yeah.
all against phone calls, unless now this has happened to me a couple of times.
Mm-hmm.
If somebody comes to me and says, "Hey, I've got a babysitter at home,"
Yeah, that's totally
or if
different.
I got a child, or
Like my
can I-
so and so's in the
Right.
hospital. I'm waiting
Right.
to hear from, or like like my boss may be calling in,
Right.
and like blah blah blah. If it's going to be like really quick and not a big deal and you're telling me about it, then like, okay, my hands are still going to be off of
don't
you.
plan your hour around a video conference and me giving you a massage. Nope.
No. Okay, so anyway, that's
Well,
my
did
story.
she ever get a massage, or did she just say...
Oh, no, I kicked her out.
Oh, she never did get the massage.
No,
then.
she did not get the massage.
But she was in a car doing the Skyping.
Mm-hmm. Yeah.
Well, okay.
No, I did not let her video conference in a massage.
Well, I just wondered if she had said, had decided just to forget the conference, but she said just forget the massage.
Yeah.
Okay.
Yeah, and I was okay with that.
Oh, yeah.
Now, I've had mothers sit in with pregnant daughters.
Yeah, me too.
I love that one because they're usually like talking to each other and like we're having fun, and then like I show her mom like a couple of things to do. The few times that I've done this, the mom was going to be in the room with her for the birthing process.
Right.
So I was like, giving her tips, like, here, if you compress right here.
The
like,
secret points for...
Yep, a little bit of reflexology.
Yeah.
Blast that baby out quicker.
Yeah, I've never seen that happen, but yeah.
You know what? When I was in the room with Sam, my cousin Sam, I was hitting all of the reflexology points.
Yeah.
And the times that I was doing that, she dilated quicker.
Well, there we have it. We got proof.
I mean, I'm just saying it happened with us.
Well, that's more proof than I have.
So, is that it for guests?
I think that's it. I mean, we've covered every avenue we can on who could be in the room. But it's up to you individually as a massage therapist. Be kind and polite. That's what I like to say every podcast.
Mm-hmm.
But, they don't have to be in the room if you choose. Say, hey, no. You're in
Yeah,
charge.
I mean, if it's like a younger adult that can handle themselves sitting off in a corner, like looking over their phone,
yeah,
then, okay. If it's an adult that's not being weird,
yeah,
then okay.
Well, I remember if you check out an earlier podcast or later podcast, you'll hear one about one that was in the room with me called Booty Shorts.
Oh, booty shorts.
So that was a person in the room with me as a guest, was Booty Shorts.
Of course, she didn't really have a chance to find out how she was going to be.
No, you have to listen to that podcast.
Yeah, that was ridiculous.
It's ridiculous.
And he came in with booty shorts. Okay, is that it?
That's it?
Wow. This one went kind of quick, did it not?
Well, we're trying to do that,
Yeah.
Try to shorten it a little bit.
A little bit, yeah. I mean, 2-hour podcast probably isn't going to...
Yeah, I mean, I
good.
tried to limit my rambling.
You're a rambling man.
Yeah, now if you want a whole hour of me rambling, we can do that too.
Oh, man. Can he ever ramble?
Yeah.
No. But, I mean, seriously, this really is just like us sitting around talking like normal.
Yeah.
Maybe less cuss words.
Yeah, you cuss a lot more than in person than on the podcast, that's for sure.
Yeah, well, I'm trying to keep it somewhat PG-13, I guess.
Well, thank you.
Yeah.
Yeah. We don't want an R-rated version of, well, maybe occasionally.
I think occasionally is okay.
Yeah.
I mean, it really just depends.
Yeah, it's according to the subject and the mood.
Well, like every time that we do one of these, we have to go back and listen to it to see if there is a cuss word. And actually put if it's explicit or not when we, upload the podcast. I don't know what I said earlier, but I said something earlier which makes this one explicit.
You know what? Making the podcast is fun. Listening to the podcast again, The third time, The fourth time when you're editing it, I don't know how you do it.
Seriously, this afternoon when I was listening to it again just to try and be a
listener.
Just a listener, I couldn't listen to it at all.
It was that bad.
I mean, not that it was that bad. It's just that I've heard it so many times doing the editing again, editing again, and then I was listening to it again, and it was just like,
oh my God, do I have to hear this again?
like after a while, it just becomes background noise.
Blah, 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 blah.
Just like that,
Blah,
yes.
blah, blah.
Yes, thank you.
Blah, 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 blah.
So, I don't know, maybe one day we'll actually have a good podcast.
No, this was a great one.
This one was good?
No, I just said that to make, build
I
your
mean,
confidence up.
I really don't know, but at least we're having fun, and that's all that matters.
Well, that's when I told friends of mine today, and when I was talking about the podcast, we're having fun.
yeah.
And so we have decided that we enjoy doing this more than watching television
Yeah.
or doing other hobbies.
I mean, this is a hobby.
Yeah, this is our hobby. You know what? Handing out food is not a hobby.
It's not a hobby.
That's a story for later.
Yeah.
See, that's when I talk about rambling. I could have rambled that story into an hour podcast.
You really could have.
Right.
Yeah. You're doing good.
Thank you.
Yeah. Yeah.
The thing is, so for now on, what Sound's going to do is tell me I'm still recording and just let me ramble on without any recording.
You know what? We should have like an after-hours show where it's just you rambling. You know what? Like Bill Maher, something like how he'll have like the section that's on HBO,
Yeah.
but then there's like the whole after show section
rambling
of us just rambling about what.
Rambling.
That'll be kind of funny.
Yeah, I like that idea.
Yeah.
That way you probably get more people with the rambling than we would with the asking questions.
I don't know. I guess it really just depends on why someone is tuning in the first place. If they actually
why are you tuning in the first place?
Yeah, people, what are you doing?
What are you doing?
This is ridiculous.
Don't you have something else to do?
Yeah, like, isn't there another podcast you want to hear?
On.
Like, I mean, like, what about TED Radio Hour?
Come on. I mean, we go through hundreds of different ones. You could find another one, I'm sure.
Seriously, I don't know. Maybe they're just as twisted as us.
Well, they're bored.
Oh, maybe that's it.
They're really
maybe they're
really
stuck in
bored.
traffic.
Oh, that's a good one.
Yeah.
Yeah, be stuck in traffic.
Yeah. I am so sorry if you're stuck in traffic right now. I know your pain.
Yeah, Sam is one of those travelers.
I really am. Yeah. You know what? I have to say I've enjoyed having my time at home a little bit more here recently.
Oh, I've enjoyed having you here because you're a more pleasant person without the traffic.
Without the traffic and without the job.
Right.
Yeah.
If we all could just quit our jobs, we could all be more pleasant people.
Yeah. You know what? I found out that I'm going to be teaching the intro course, anatomy.
Yeah.
That makes me very happy.
Why?
I like teaching anatomy.
You know what? I'm happy that you're able to do that then.
And also, it's not me in charge of a whole course. You know what I mean? Like, that's a lot more responsibility
Gotcha.
than me just coming in for 2 days and teaching anatomy.
Gotcha.
So that's nice. Plus, I love it. This is the thing that I love about teaching. I love it when, like, you throw out a word like, sternocleidomastoid, and, like, all the students, like, get all wide-eyed, like, what the fuck did she just say?
Just like I did.
Yeah. And then by the end of the module, they know it,
Or it could be like me. I could still be wide-eyed at the end of the module, too.
No, you get it. If I was teaching you, you get it. I promise.
Yeah, I'll get it.
Yeah. You've only been massaging for 15 years. All right. Well, thank you so much for joining in. I had a blast.
Oh, yeah, I had a good time.
Yeah, this one was fun.
Thank you for listening.
Yeah, thank you so much for listening. And you know what? Even if it is just us sitting in the office talking to each other, it's what we would be doing anyway.
Yeah, we're just
recording.
recording.
But if you happen to be hanging out with us and you're listening, thank you so much. This is awesome.
You can let us know at some places.
Oh, yeah. Come and check us out at Facebook, Ask a Massage Couple. And then, of course, if you have any questions for us, or if you have any stories, please send those in. askamassagecouple@gmail.com.
That's easy to remember.
Yeah. And, like, we keep saying this, like, eventually we'll get on Twitter, eventually we'll get on Snapchat, Instagram, all that good stuff.
Yeah,
eventually,
we are going to head towards being multifaceted in the in the sphere of all the things that happens to be out there electronically.
Yeah, we might want to set up a website first.
Oh, yeah.
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 So, like, we'll more than likely, like, take this slow, guys. But if you're listening, thank you so much for supporting us.
Tell other people.
Tell other people. Maybe they'll have just as much fun laughing at us as we do when we listen back. All right, guys. Well, have a good night. And,
Good night.
bye.
Howdy-ho, time travelers.
Howdy-ho.